Hello, and welcome to another live broadcast with MedStar Health. My name is Amy Cameron, and I'm joined today by Dr. Christina Enzmann, a gynecologist and menopause specialist with MedStar Good Samaritan Hospital in Baltimore. We are proud to partner with Red Hot Mamas, the leading nonprofit provider of MedStar education, menopause education, and support programs in the US and Canada. Today, we're going to discuss ways to treat menopause, including hormone replacement therapy, herbal supplements, lifestyle changes, and more. So if you or someone you know has hot flashes, night sweats, weight gain, moodiness, and other symptoms and needs support, give us a like, let us know you're watching, and share this broadcast with your friends. Let's meet today's guest, Dr. Christina Enzmann, a board-certified gynecologist with expertise in menopausal medicine, endometriosis, fibroid management, and minimally invasive surgery. She went to medical school and completed her residency at the University of Hamburg in Germany, as well as an additional residency at Sinai Hospital in Baltimore. She wants to empower women to conquer their menopausal transition as a positive health milestone and help them enjoy their midlife to the fullest. Welcome, Dr. Christina Enzmann.
Hello, very good being here again.
We're so happy to have you. We often hear the terms perimenopause, menopause, and postmenopause. What's the difference between these conditions?
Love that question, and a very good question. So the perimenopause can be quite a long time. It's all this time when the ovaries start to slowly age. And I always tell my patients it's between 8 and 10 years, maybe a little longer. So, and it lasts, and that's the most important thing, it lasts for 12 months after you had your last menstrual period. So, maybe early 40s, most typically this perimenopause starts when we have cycle irregularities. We start to have maybe hot flashes, maybe not yet. And then comes that last menstrual period, which is really what determines the term menopause. Menopause actually really means that last menstrual cycle. You can say my last menstrual cycle was, let's say, April in 2018, that is actually menopause. After that, the time is actually called postmenopause. So actually, we should call all us women that we are postmenopausal women. That's the correct term. However, I know we always say menopause, it's kind of nicer, and that's fine. Yeah, so basically perimenopause that ends once we had 1 year for sure, no menstrual cycle. And then everything that comes afterwards, it's postmenopause. And many women spend a third to a half of their life in postmenopause. And it's a good time. And we talk more about it, which is good. And we are here to empower women to know what this is all about. And there's nothing to be afraid of. There's just some tricks and knowledge things you should know to make this a better time.
Awesome. Thank you. What's the typical age and the signs when perimenopause ends and menopause, or I guess postmenopause, begins?
So basically these perimenopausal transition, as I mentioned earlier, starts typically in the early 30s, but it can start also much earlier. So normal menopausal age is really from age 40 on. We are like, this is actually normal. Between 40 and 45, we call it kind of early-ish, but it's still normal. Everything that is earlier than age 40, we call premature menopause. But so consider, yes, so if you really have your last menstrual period at age 42, this is actually, we deem this within normal limits. And a person that gets so early, sees so early her menopause, she will have symptoms much earlier, like in her mid-30s, for example. The typical symptoms are, as I mentioned, cycle irregularity. And it's often we think, oh, the cycles, they start to skip and they just stop. It's not like that. Some women are lucky, it is like this, but often it comes with heavier anovulatory bleeding. So there might be heavy cycles, or the cycles get shorter together. So often women come and say, hey, suddenly I have 2 cycles a month. And I have to say, this is probably still normal, because the maturation of the egg goes so much faster once your egg reserve has depleted. So that is, menstrual signs. And then other signs can be mood changes. We see more premenstrual dysphoric disorder or PMS in perimenopause. This might be just more more accentuated. And then later on, there come hot flashes. Once the last menstrual period is really close, you might or might not, might be joint pains. And these are all signs often of once the estrogen decreases. Later on, let's say we are, okay, so I think the most important symptoms most women notice are the hot flashes. That's when most women start to be like, what's going on? And I can't sleep and I'm moody. These are kind of important signs. And fatigue, I also would say, is one of the most common one. And then insomnia. Again, these are they are the strongest really right around this last menstrual period, because you don't know when this last menstrual period is going to be, but that's when they're the most intense and the most couple of years after that. And these same symptoms might be a little bit milder in many of the years leading up to it. Once we are in postmenopause, that means we have been 1 year already without our period. For the next couple of years, you might have still these hot flashes. And later on, basically, once these estrogen levels are really settling down at a low level, there might be more symptoms of the estrogen deficiency on the vaginal and genitourinary tract. So that's when then women complain more about urinary frequency or urgency. Sometimes there is some incontinence. That is really often, very commonly, a later effect. It can happen earlier, particularly in women who haven't born children vaginally. So that is one good thing about when we have babies vaginally, they kind of stretch these tissues. So the estrogen deficiency effect doesn't hit these women so early. Yes, have I answered all your questions now?
Yes, I think you covered all of our symptoms of, I guess, signs of perimenopause, and then into symptoms of menopause and postmenopause. I was going to ask you how long do those symptoms last, but you covered all of that. Can you touch on declines in cognitive functioning? That I see that's one of the symptoms.
Yeah. So, with changing estrogen levels, so estrogen is an important aid for our neurotransmitters. It helps with the degradation of our neurotransmitters. So I always say, so our brain has to get used to living with less of this help of estrogen. So there's no need to be worried. So basically, our brain is going to adjust to a changing environment once the estrogen gets less. So the cognitive dysfunction, so that's a very broad term, right? So most of us, we are afraid about dementia. Sorry, something is singing here about dementia. So menopause doesn't mean we are all going to get dementia. Many of us might have some genetic predisposition for that. So we know, so the effect of hormones in perimenopause, or if we give them externally in terms of dementia, is neutral. We know if we start hormones later on after age 60 to 65, it is not helpful at all. So cognitive dysfunction, or also like mood issues, they can get, okay, so women who had depression in the past, they are more likely to have these symptoms exacerbate again.
We had a question from Trina who's watching, and she asked, is it normal to have more anxiety in menopause?
Yes. Okay, thanks for this, because I could go on. I'm just, how do I focus this question? So yes, the anxiety is a very typical sign of this estrogen first going on roller coasters in perimenopause, and then, slowly weaning down. So the anxiety is very typical, actually. Yes.
Okay, good to know. Thank you. How is menopause treated? Are there any ways to treat it?
All right, so first I want to say menopause is not a disease, okay? This is just a state we are going to be in, and we gave it a name, the postmenopause. So, and I also want to say, and I have mentioned this earlier, I have many patients, they transition through that and barely notice it, Okay, this doesn't take away from the women who actually do have symptoms. We take this very seriously, but just be aware, we're not all going to be miserable. And there are many lifestyle changes that you can do. And remind me later that I'm going to get to these. Sorry, your question, what was your question?
How can we treat it? Are there any treatments?
Okay, so there is a myriad of symptoms, right? But the most common one and the most bothersome one are the hot flashes, which we call vasomotor symptoms, and insomnia and joint pains, I would say. For the vasomotor symptoms, which can be very disruptive, there is, so the hormone replacement therapy. I'm just mentioning this first, okay? Because we're just going down the list. It's still the most effective treatment for vasomotor symptoms. So yes, and we had a different podcast about hormone replacement therapy, and please remind me later. We're just going to address that, a different question, please. So hormone replacement therapy, very effective, and it's appropriate for women who are in early menopause and are otherwise healthy. There are what we call non-hormonal treatment options, or we call them also second-line therapy options to hormone replacement therapy. They are not quite as effective, but still pretty good. And what comes to my mind is a medication many of you might have heard about, which is gabapentin. It's an old-fashioned, I always say old-fashioned seizure medication. We don't use it these days, I don't think, for seizures at all anymore. We use it a lot for pain perception in surgery. We do use it for in diabetes patients when they have neuropathia, and you're going to be surprised, it works very well for hot flashes actually. It's also slightly sedative, so I really love that for patients who have most of their issues or their hot flashes at night and can't sleep. Works very well in most patients. Another second line therapy option we use are coming out of the antidepressant medication. So this SSRI or SNRI. So these are the selective serotonin reuptake inhibitors. And you might have heard serotonin often called like the happy hormone. So these hormones, so these medications keep that level up. And we don't have to give these medications in the doses we give them like for depression. We give them in tiny little doses, and they have been used for many, many decades actually for hot flashes. And one of them has also FDA approval now, which is paroxetine, that is Paxil. So it's called Bristol when you give it in this tiny dose. However, if the insurance doesn't approve that, we can as well do the generic one. Then Lafaxine is one of the other ones. And Clonidine, which is an old-fashioned blood pressure medication. I don't see it anymore in the current recommendations, but if you're anyway hypertensive, so the Clonidine patch has been said to also be effective for that. And we're going to ask about then the other things later, right? You're going to give me the questions for the herbal stuff in the next.
Yes. And I actually have another question from the audience. So there are a ton of medicational options. So that's that. And then Megan in our audience asked, do you have any recommendations on cookbooks or wellness books that can help on using diet to ease symptoms and support the perimenopause body?
I love the question. My whole bookshelf is full of books, however. So, but I found something else actually online. It's an app that is called nourishingmeals.com. The reason I love that one, I have nothing to do with it, no association. I just got it recommended from colleagues who are in the functional medicine realm. So the nice thing is it has all these functional medicine diets in there. And the most important one really for menopause is the anti-inflammatory diet. So you basically sign up, it costs you $4 a month, and you get like thousands of recipes. And you can basically click anti-inflammatory diet, and then you can say, I want to skip gluten or dairy, which is actually already excluded in the anti-inflammatory diet. But anything else you want to add, or low glycemic diet, you can add that, and it gives you thousands of recipes. And once you've done that for a while, you're going to better understand how to cook and how it makes you feel. Apart from that, and if you want to book, go for an anti-inflammatory book. So I mean, paleo diet in general is also good, as long as you make sure, and that's now for people who just want something very rough idea, eat 7 cups of greens and veggies a day. Get yourself like a Pyrex, one of these food containers, and stuff it in the morning with leafy greens and other greens and veggies. That is the minimum thing you can really do, because that is gonna help to turn on your good genes and quieten the not so good genes in terms of your metabolism and overall health. And in the summer, you can just eat it as a salad, start in the morning and eat the rest in the afternoon. And if you rather have your veggies a little bit sauteed because you don't tolerate it when they're raw, do that. It doesn't matter. The sauteing has the benefit, actually, the amount of greens and veggies you have to eat is actually going to decrease a little bit. So, yes. So
that's good. That's
I hope
good.
I answered that
I like
question.
to shove my greens in a smoothie, and that's like an easy way to
Or
get them.
fruits in a blender, yes. But these, so I was always very strict with this anti-inflammatory diet, and there's actually data that alone these 7 cups of greens and veggies, if you can do nothing else, this is the first thing you should do.
Oh, good. That's an easy first start. A couple more questions from our audience while we're talking about treatment. I did have someone ask if the symptoms and treatment are different between natural menopause and forced menopause.
Well, forced menopause here, the viewer refers to, let's say, surgical menopause, right? A woman in her 30s gets the ovaries removed for, let's say, endometriosis or other reasons. In that regard, the very clear recommendation is to go for hormone replacement therapy. And the reason really is that there's abrupt removal of the hormonal function for women has detrimental effect on the health, right? There's like an earlier cardiovascular aging, and it has an effect on bone health. So here the North American Menopause Society is very clear, unless there are like, complete contraindication, like the woman had breast cancer. That would be one of the only reasons in my mind that woman should go on hormone replacement therapy until age of natural menopause, at least. So, 50, 52.
Okay.
Yes, there I would not, again, because there you need more than just eat healthy. It would be really good if you can really just maintain the natural state of having these hormones available.
Thank you. And thank you, Chrissy, for your question. Let's get back into some other questions, but let's first pause and welcome our new viewers. Thank you for joining us today. We're live with Dr. Christina Enzmann, a board-certified gynecologist, discussing how you can tame menopause. If you haven't done so already, give us a like, let us know you're watching, and share this broadcast with your friends, and leave any of your questions you might have in the comments. Let's talk about, we were talking about hormone replacement. So what are the current guidelines for hormone replacement therapy?
All right. So the North American Menopause Society, which actually has a very nice website also for consumers. It's called menopause.org. So everyone can always go there, and because there's lots of things out there and all kinds of people are trying to tell you tit or tat, please, menopause.org. They are really that organ that after the World Health Initiative studies, once everyone got scared of hormones, these were the people who said, a moment, please, let's look at this data actually a little bit more correctly. They're very supportive of the women. And so what they're saying, that for young menopausal women, so that means right after onset of menopause, and if they are less than age 60, in general, the benefits of hormone replacement therapy still outweigh the risks. Okay, so if you're healthy, which means, so basically the big contraindications is, in my mind, is always personal history of breast cancer. Not breast cancer in your mom or in your grandma. If you had breast cancer, yes, that's a contraindication. If a woman has an uncontrolled hypertension, right? So she is already on blood pressure medications and the blood pressure is still not under control. That is also it's relative to strong contraindication, depending where the blood pressure is and how many medications are needed, because I'm going to tell you the risk in a second of the hormone replacement therapy. And and personal history of pulmonary embolism, deep vein thrombosis, or a heart attack, cardiovascular event. These women, unfortunately, are not good candidates for hormone replacement therapy at all. So what are the, let's say you are young and healthy and you want to start hormone replacement therapy, what is the risk? We always hear about the breast cancer risk. Here is to be said that after that Women's Health Initiative study data was again reviewed, the breast cancer risk was not increased for the women who only had to take estrogen. You have to understand, if you have a uterus, you have to take estrogen and progestin to keep the endometrial lining thin. If you only have to take estrogen because you had a hysterectomy, you are apparently much better off because the risk for breast cancer is even lower. If you have to take a progestin or bioidentical progesterone, the data showed with a synthetic progestin, there is a slightly increased risk, but it's still very low. The data reads as saying it's one additional case of breast cancer in 1,000 women years. This is just statistics, and that might not tell you nothing. And if you have to take progestins, it's 3 additional cases in 1,000 women years. However, so the way they say it is the risk is really only slightly increased. And particularly for the estrogen only, the risk of breast cancer seems to even be lower for the first 7 years of usage. And the interesting thing is that the overall mortality, so the reason you might get sick from other reasons, like the risk for colon cancer, diabetes, many other things, that risk is actually decreased for young women who start hormone replacement therapy. Okay. Did I answer all this?
I think you did.
I kind of law. I'm like, I'm just going to go on and on and on.
Yeah, you touched on the risks. Oh, but overall, is hormone replacement therapy safe?
Okay, that is like this question, like is some, there are no guarantees in life or nothing. I'm always saying everything we do has potential side effects, right? So is it safe? That is a very general question. There are potential risks, but I think what the North American Menopause says there, in the benefit outweigh the risks in young women. I think this is the right statement to be.
Perfect. Yeah, that's great. Okay. Are there non-hormonal treatments for menopause?
Yeah. So as I mentioned, for menopause, again, it's not a disease, so we don't have to treat menopause. The question is, what is the problem, right? And for the vasomotor symptoms, I mentioned the hormone replacement therapy is still the most effective, and we mentioned about non-hormonal prescription medications. Now I could elaborate and what else can you do, right? What can we do to, maybe we don't want to do any of these, we just want to do like a more natural approach.
Yeah, you talked a little bit about diet.
Yeah, exactly. Diet is unbelievably important. So we know, like, more in the functional medicine realm. So the hot flashes have a lot to do with blood sugar stability. Of course, inflammation. Inflammation is really, we think now, the root cause of so many diseases, from metabolic to cardiovascular to cancer. So sleep is super important, and stress. And you might be saying or thinking, well, there's nothing new that we should stress less, sleep less, but we now have data. This is so powerful. There are studies that have shown that a very vegetable-based diet can decrease or eliminate hot flashes in a group of women within 12 weeks. You just have, this is unbelievable. This is the VAVA study. I'm blanking on the thing, but it was published recently, and they repeated it. So, and then in terms of sleep is so important, because as we get older, first our stress reserves, let's say it like this, we get more sensitive to stress. Additionally, that our lives are becoming more and more stressful as we get older, right? For most of us. So the cortisol levels, they disrupt our blood sugar levels. And that causes then, once the blood sugar levels are going on a roller coaster, you will have more hot flashes, and it increases inflammation. So that is why the blood sugar stability is so important. And, a very clean diet helps. Have protein in the morning. One night of poor sleep is going to affect your blood sugar levels for the next 3 days. So
Wow.
if you have a night job that is really, we can't change it, but you have to do everything else to help your body then. So sleep and the circadian rhythm we know is super important, again, to keep our genes working optimally. So I always say you have to go to bed prior to 11 p.m. and try to get 7 hours of sleep. So sleep is important. Cortisol levels, right? Stress, it's going to be hard to decrease all stress in our life, but there's now data that shows, you can change the way our brain responds to stress, to elevated cortisol levels, and that's what you want to do. You want to shelter your brain from the ill effects of stress, and this can be done by meditation. I always thought meditation is boring until I saw that data. So 10 minutes twice a day can significantly decrease your cortisol levels. So, and you might know there are thousands of apps out there that help you to do that. Try it out. And then in general, mindfulness, is it that you just try to make time for yourself? Schedule 10 minutes of outdoor time, which is also going to help you sleep because the sun is going to help with your circadian rhythm. Or you go out in nature, whatever you can get into your busy schedule will help.
Well, those are some great tips.
And you're going to ask me also a little bit later about other herbal remedies. Is that?
Yes, I will. I do want to touch on, so Angela in the audience asked if you would recommend a carnivore diet. My daughter said it's good for hormones, but it sounds like you recommend plant-based.
Yes.
Plant-based greens.
So I want to clarify, we have very little time today. Many of these studies were done on vegan diets. I don't think a vegan diet is really good long term. These studies were 12 weeks, so they couldn't see the ill effect of the vegan diets.
Okay.
So particularly when you're in menopause, the nutrients you get from meat and eggs and meat, eggs, what else do we have? Cheese is a little bit inflammatory, but like fish. It's really important for our neurotransmitters and our hormones. So I always say, please don't stop the animal products if you can. However, it should be more used like a condiment when you eat. It shouldn't be like you have a big T-bone steak.
Mm-hmm.
The carnivore diet has been, was popular because you can really lose weight quickly on it. But what's going to happen, the high saturated fat content and the overall inflammatory and acidic response in your body is going to increase inflammation. And after a while, it's going to stop working and you're going to start getting joint pain. So no, please, no carnivore diet. You want, I always say, again, to make it easy, whenever you eat, 80% on your plate, breakfast, lunch, and dinner, should be 80% greens, veggies, nuts, and seeds. And then the other 20%, can be your meat or your grains if you have to, or your eggs or your salmon.
Okay. You mentioned an app earlier that you recommended for people to go to for diet.
Nourishingmeals.com.
Nourishingmeals.com. Okay, thank you. We had a couple people asking about that. Yeah. Okay. I was just looking to see if we had more questions, but let's get back to our other questions. You talked about non-hormonal treatments. Can you talk a little bit more about functional medicine and how that plays a role in menopause?
Yeah. So I just wanted us to talk about it because that's kind of what is something I like to do. But there are different alternative, treatment methods out there. One is the integrative medicine, and then functional medicine, and then there's anti-aging medicine. So, but you have to understand the one specialty that is actually acknowledged by the American Association of Medical Boards is actually only the integrative medicine. That is something where a physician can make a fellowship and then you get a stamp that you're basically fellowship trained. Integrative medicine is basically conventional medicine, but it integrates other holistic treatment approaches. For example, in order to treat your blood pressure, you might get your regular medications, but you might get a prescription for massage therapy, yoga, acupuncture, maybe some herbal supplements. That is that. But other than in the end, it's a very normal, conventional approach to disease. You have something, we give you something, be this yoga or supplements. Functional medicine is not a regulated space, just so you know. This is more, however, what we do is it's when people are interested, what is actually the root cause of what is going on? What is actually behind it? How can we fix the problem from the root? Instead of me giving you a prescription, be it just a supplement or a prescription medication, it's, well, what is causing, for example, in your case, your hot flashes? Is it your stress or the insomnia? What else might, or is your blood sugar instability? And then the treatment approach goes in that direction. So basically, then we start to find ways to help with whatever the area needs improvement. And so functional medicine, as I said, is in very unregulated space. So everyone can practice that. You can just be a health coach. You don't have to be a physician. Nevertheless, I love this approach. There are many physicians in that space, and I always want to say it's kind of the science geek or nerd that you'll find in there. So, you know, many things that are really new on the science market will be adopted into functional medicine. So, you know, everyone talks about the microbiome now. This was really a concept that started in the 1990s in functional medicine, where everyone was still saying, you people are just crazy. And it's like, it takes usually 20 to 30 years, and now everyone is on it. So I think I explained that.
Yeah. So you would take more of an integrative medicine approach to
functional medicine. I know I'm not, it's functional. I like the root cause, you know. I like the data that comes really out of that area. So the new stuff, the microbiome, the digestion, how we can change the way our DNA works to our benefit. That's that approach that I love. It's a longevity approach.
Okay. And then you touched a little bit on integrative medicine when you were talking about functional medicine. Can you tell us a little bit more about how integrative medicine can help?
Yeah, so as I said, the integrative medicine is actually a proper board and a board certification. And this would be then, for example, if in addition to prescription medication for hot flashes, for example, you could also, then we would integrate yoga therapy. The data on yoga and hot flashes is mixed. Nevertheless, it helps many women, right? So yoga, and then if you have a lot of mood symptoms, you know, there's the mind-body therapy, behavioral therapy can be very helpful, and there can be other supplements that can be used.
And you mentioned herbal remedies as part of.
Yes, so you know, I just want to say black cohosh. Many people read about it. I want to say it hasn't been shown in it has been studied extensively. It doesn't hold up in any trials to really be more effective than placebo, which doesn't mean that, you know, there are many supplements out there, they mix different herbs in there, that it's not helpful for one or the other woman. So just so you know, I'm not going to bash it. There are other things, you know, in someone who, for example, has lots of stress and that really worsens their sleep, they can't sleep. What I like is ashwagandha and holy basil. You find this in many, you know, combination supplements, because these actually have shown to shelter the brain from the negative effect of stress. So if you're wired and tired every night, and that might be some supplements that might be worthwhile considering. For insomnia, right? So if you can't sleep, one of favorite what can be helpful, passion flower. Passion flower supplements is actually, because someone mentioned anxiety earlier, they say it's like the natural Xanax. not sure if it's that effective, but it's apparently really good for anxiety.
Oh, is what you said.
Then,
Okay, good. Because
then
CN had asked about treating anxiety related to postmenopause. So passion
exactly, the passion flower is a good one. If someone really, what else can be really helpful for anxiety is magnesium biglycinate. Magnesium is a mineral that we need for most of our processes in our body, and it happens to be calming in our neurotransmitters. So magnesium in high dose together with taurine. Taurine is helps magnesium to be absorbed and calms our neurotransmitters and increases GABA. GABA is the GABA aminobutyric acid. That is the one neurotransmitter we want to have in good high levels to keep us calm.
Oh, good. Okay. Angela had asked about anxiety, migraines, brain fog, and forgetfulness. Would magnesium help with those things as well?
All right. So forgetfulness. So very important, blood sugar stabilization. That is super important. So in Alzheimer's is called now more and more the third diabetes. So we know this accumulation of amyloid in the brain has a lot to do with blood sugar instabilities. There's a great book from Lisa Mosconi. She's a neuroscientist, and she wrote the book. I think it's called The XX Brain. Read that. There you have all the data in there. So yes, blood sugar stabilization. And then wait, she asked for migraines.
Mm-hmm.
Again, I would start with the blood sugar stabilization. Sometimes sometimes migraines get triggered from high estrogen levels. And there's another topic I don't really want to get into, but I'm going to mention it anyway. It can get triggered by histamine rich food. So you guys can Google that, what that is. So basically, high estrogen levels, how we often have them in perimenopause when the estrogen goes into this roller coaster. And then histamine in our body, which is a very important factor. Histamine is not only allergies, it's also a neurotransmitter. However, our body has to metabolize it. Otherwise, we might get GI symptoms, migraines, headaches, all kind of things. And when you have lots of estrogen around or unopposed estrogen and dominance, then that histamine gets slower metabolized, and then you might get these migraine symptoms. And then if the glass of wine that you usually tolerate at that time of the month, you don't, and you get a raging migraine. So yes, please, you can Google that, histamine rich food.
Can you touch on the kind of magnesium that you mentioned? Will you repeat that?
Yes, magnesium glycinate or biglycinate. And that the reason is that is best absorbed and has the least of all diarrhea side effects. So, the magnesium citrate, which is usually the cheap regular one that you get, there's kind of a limit how much you can really take in before you have to run to the bathroom. So the magnesium glycinate doesn't do that, and you should take at night 300 milligrams, 300 to 400.
Okay, thank you. And then you touched on blood sugar as being important. Is there anything natural for blood sugar stabilization besides Ozempic? And this is from Paula.
Yes. Well, yes. First of all, I'm not a fan of Ozempic because it just gives, it's like a band-aid solution and no one addresses the underlying problem. So
Right.
first of all, change your diet. Go on a low glycemic diet, lots of greens and veggies. That would be a good way, and you don't need the Ozempic. However, what is helpful for blood sugars, and that is data-driven, you're not going to believe it, it's apple cider vinegar. That's actually been shown. If you have just a little bit of apple cider vinegar in a glass of water before you eat, it's actually going to decrease the blood sugar response of that meal.
Oh,
So
wow.
and you can have a glass of that in the morning and just a little bit until it doesn't taste bad. So that cinnamon you'll find actually in many over-the-counter diabetes supplement, and that's the reason it really helps. navy beans, interestingly. So the leptins in there apparently help with blood sugar stabilization. And all fermented foods, because they help with the gut microbiome. And then there is something out there that's called berberine. Berberine is a supplement that comes from golden seal plants. You'll find these, and you can buy it like this or in combination with other things. It's supposed to be as good as the medication metformin in helping to stabilize blood sugars. So just saying, all right? Please, you go to your doctor on this. I am not treating any one of you. This is just my experience sharing with you. But yes, there are plenty of things out there. But in the end, I always say, change your diet. Take this seriously, because when you change to these greens and veggies and you give your body the nutrition it needs, it's gonna fix most of other metabolic issues in your body, and it's going to help in so many ways.
I did have a question from Fran, and she's concerned about weight gain. She says, dieting, exercise, nutritionist, and nothing works. Can I take testosterone for weight loss?
Yeah, so here, so in women who have already been doing lots of dieting, I see that a lot. They exercise and they're behind it. So it can cause that cortisol response. So you should go to an experienced practitioner to teasel out what's going on in your case, because if you exercise too much or if you diet too hard, because I'm not telling you people not to eat. I want you to eat. I want you to eat so much you get healthy. So eat your greens and veggies. But if you food restrict and diet, and then not eat enough carbohydrates over a long time, your thyroid function is going to take a hit and you're going to have a hard time losing weight. Additionally, if the cortisol level rises, and you can get the cortisol level up by over exercising in our age, you're not going to lose weight. So you will need someone who really looks what's your situation and then figure out what has to be done.
Okay, thank you. That's great. Susanna, we're talking about diet, said she found relief in a diet higher in healthier fats like avocado, olive oil, fatty fish to provide symptom relief. Is there any evidence to support that?
Yes, so because the healthy fats, these are basically mostly unsaturated fatty acids, and they are anti-inflammatory. So, and as I told you before, this inflammation is one link of all these things that are connected. So yes, so it's anti-inflammatory, and the healthy fats, they decrease your blood sugar spikes. So whenever you even eat, your dessert, but you eat it after you had a really healthy meal with healthy fats, it's going to decrease that blood sugar spike. So yeah.
Okay. And then Kelly said she found that gluten makes her hot flashes worse. Have you had any of your patients experience that?
So yes, if you have a food sensitivity to gluten, that's going to make everything worse. The anti-inflammatory diet is gluten-free. So yes, it's acknowledged, but it might be food sensitivity. It might just be that your blood sugar spikes immediately after you eat gluten, because it's a very simple carbohydrate you get, in your pasta or buns or whatever you eat. So, yeah.
We've had a ton of questions from our audience, which is fantastic. I'm going to ask you to touch again on, Kelly had a question. Do you have to be postmenopausal to start hormone replacement therapy?
Very good question. So, not necessarily. So, if you're in perimenopause, and so what I do in perimenopause, usually, let's say you have your first hot flashes, you don't sleep well, your cycle is all over the place. So you can actually only take bioidentical progesterone. And there's actually data behind that. So you can take that in little higher doses than usually, because you're trying to counteract this high bouncing estrogen levels. You give only progesterone at night I often do this, and then that works for 1 year or two. Women sleep better, the hot flashes are gone, and then when she gets again hot flashes while on progesterone, then we start adding the estrogen. So yes, absolutely. And again, conventional approach and North American Menopause Society guideline, if you have been on the birth control pill and you're low risk, that can be a very, very elegant transition into menopause. The more functional medicine I do, I'm the less fan of it, but it's perfectly correct to do that too. Yes.
Okay, so you kind of touched on Jen's question as well. Is it beneficial to start hormone therapy in perimenopause?
You can, but depending again what's going on, heavy bleeding or hot flashes, someone would have to really listen to that woman and see what's actually going on. There's no blanket approach, in my opinion.
Yes, that makes sense. Megan had a question. How does a doctor diagnose perimenopause? And is there anything a doctor can do? I guess maybe to slow it down or.
Yeah, so again, perimenopause, it's not a disease, okay? How do we know? So there is my favorite topic. So the STRAW criteria, so they were actually scientists. So STRAW criteria stands for stages of reproductive aging. There was a whole workshop and they had criteria that came from blood work, but mostly actually menstrual cycle signs and physical symptoms. So basically there's different stages. And once you have missed your period for 6 months, even if it comes back after that, you are basically in the latest stage of perimenopausal transition. And that means you will see your last menstrual period within the next 3 years. So this is what we know. That's good hard data. Before that, right, then it's this -2 stage, can take several years. But basically, once your cycle length varies 7 days from the previous cycle, then you are also already in the early perimenopausal transition. And slowing it down, ovarian aging is what it is. So we know even many women these days take really good care of themselves and they are young and eat healthy, and then they always think they can kind of, they think they might still get a baby when they're 43. That's not working. Our ovaries, unfortunately, have this, I call it the programmed cell death. It's gonna come, and that, for some of us earlier, maybe there can be life stressors. Often it's just genetics. So there's not much you can do. Having said this, if you are not living healthy, lots of inflammation, you're smoking, your ovaries are going to give up earlier. So, so certainly you can, if you live an anti-inflammatory lifestyle, start as early as you can probably prolong, you can get the best out of your ovaries. But when it's over, it's going to be over.
Okay, great. Thank you. And I think you touched on a lot of this, but you talked about lifestyle changes and exercise. What do we need to know?
Sleep, number one. Sleep enough, go to bed at 11 p.m. Next morning, make sure you get out in the light. You want your circadian rhythm to be super stable. Move or exercise. You don't have to start training for a marathon. It's not a thing. If you do 30 minutes of exercise or just brisk walking every day, excellent. Eat yourself healthy. I'm not saying diet. Eat as much greens as veggies as you can. Eat until you're full. Make sure you get the good stuff inside of you. If it doesn't matter if you're not able to purchase organic. We have data that tells us if it's just greens and veggies, whatever, it's already gonna help. Make time for yourself, okay? That has also shown to really help with this DNA methylation. Meet your friends, make sure whatever you can do, it will help. And do whatever feels good. Take time for yourself, yes.
Okay, thank you. We've learned a lot today. As we start to wrap up, Dr. Enzmann, any parting thoughts? You had a lot of good tips just now, but anything else you would want our audience to walk away with?
Try to prepare for the menopausal transition in a positive way. This is not something where you should expect disease or being sick. it should be a time where you should reflect on doing positive lifestyle changes. This is now really the time, so you can really live your postmenopausal age in health. You want to have this time and live healthy. You don't want to have joint pains and not be able to move. And the earlier to prepare for that, the better.
Great. Thank you so much. And we had a lot of great questions from our audience today. We weren't able to touch on all of them, but we will send those questions to Dr. Enzmann and we'll get back to you at a later date. To request an appointment, please call the Women's Health Specialist at MedStar Good Samaritan Hospital at 443-444-5761 or visit medstarhealth.org/Enzmann. For menopause resources, visit redhotmamas.org, and we'll have all of those links and that phone number in the comments below. Thank you all for joining us today, and thank you, Dr. Enzmann, for your time. We really appreciate it.
Until next time, bye-bye.
Bye, thank you.